Hi, good afternoon.
Hi, good afternoon.
Yep. So yesterday we started discussing some aspects of pathophysiology, and I started by explaining periods of diseases. As you can see on this graph now, what this relationship is all about is, sorry, is the number of pathogens in relation to what time. So over time, when there's a disease cause, from the onset of that disease, you can see here there's a beginning. Obviously, here will be zero. Let's assume this is one, two, three, 4, and 5. This is in weeks. I'm just giving an example. So for the first few days of that disease, the course of that disease, you have what we call the incubation period. Then we have the prodromal period, then period of illness. As you can see, that's how the graph is going. So the peak of it is when you have the actual period of illness, and then you have the period of decline, you have period of covalence. Now, the incubation period, there might not be any signs at all, any symptoms at all, but then there's still that pathogen there in the system. However, at the period of prodromal period, we have it when the immune system is trying to fight. So the patients will present general signs of headache, dizziness, nausea, vomiting, and fever. So at that point, you can't really state or say, okay, this is the actual disease condition. But however, there are, obviously there's a disease condition. So until you go further for different investigations and then some patient history before you can arrive at a diagnosis, then we'll have next the period of illness, which will show the actual features of that disease. Particular diseases, some of them have some specific symptoms and signs. So at the period of illness, that's where you have all of those things manifesting. Then you have period of decline, maybe due to medications, after treatment and all. Then there's a period of decline. The number of pathogens begin to reduce, they go down, and there's period of convalescence, which is recovery period as a whole. So that's what the period of disease is all about. Then next again we'll talk about is nitrogen narcosis. Now this is a this is a condition which comes from okay, it's supposed to be here. Okay, yeah, it's supposed to be here. This is a disease condition that comes as a result of high nitrogen value or high nitrogen found in the system. Now, before I go further to explain this, there's what we call the occupational, there are occupations or people we refer to as what skydivers, and then there are what sea divers. So these skydivers obviously are those that you find them diving there in the sky, in the air, dropping down from maybe an aeroplane or a jet, whatever it is. So people go for fun. They go for all of those things to have fun and stuff. So those people working there in particular, they are exposed to some kind of conditions. Because remember, I told you once that all occupations have their disease risk. That means people working in those kind of settings, even those working in the health facilities, obviously, they are exposed to some kind of diseases, wherever it is
Yeah.
anyone is working. Yeah, so all of those things are called occupational diseases. So for these skydivers, the occupational diseases they are being exposed to is what we call air embolism. Air embolism. While for the skydivers is gas embolism. Now, what is even embolism? Embolism is what the swelling of a vessel, blood vessel, blood vessel. It could be swelling or blockage of blood vessel due to yes, but due to an underlying cause. I don't want to write material there because air, of course, is not an actual material that we can use. Underlying cause. Now let me explain this. If these blood vessels are swollen, there's something that must have happened. Now those that dive in the skies, of course, they're exposed to what so much breeze and wind blowing in. So by the time it gets into their system, there's a possibility that it can rupture and go into their vessels too, and then you have so much air. So also when there's in terms of the hospital setting, when you try to give an IV injection, make sure there's no air bubble inside. That's intravenous injection. Make sure there's no bubble inside the syringe. If not, you'll be transferring air into the person's blood vessel, and before you know, that's the vein. Before you know it, that air will go in, and then it will cause problems. So that's the air embolism. It will cause obstruction. It will cause swelling of the vessel. In terms of gas, it is gas that's causing it. We have different types of embolism. If it's thromboembolism, that means thrombo comes from the word blood. That's thrombocytes, the platelet. So it means that it is the platelet there that's been clotted and then forming that's been aggregated and then causing that swelling of the vessel. So whatever it is, you attach that word to the word embolism. So in this case now, when we talk about the sea divers, we refer to the kind of disease condition they have. There's nitrogen narcosis. And by explanation, the nitrogen narcosis, this is when you have over 79% of nitrogen found in the system. Sorry, this is not so clear. And of course, partial pressure is actually greater than 1. And then it has a depressant effect on the CNS, depressant effect on the CNS. Now, usually, we're talking about sea divers here. So normally, when these sea divers go beyond 30 meters down the sea, they are being exposed to this kind of condition. And then it may mix what? It may mix alcohol. So this is talking about the whole feeling you have when you take alcohol, the euphoria, the lightheadedness. You can see some of the symptoms here. Lightheadedness, tendency to laugh. Of course, these are features of those who drink alcohol. Then poor concentration, short attention span, impaired judgment, and all of those things. So that's about nitrogen narcosis. Then we have types of reactions, all types of pathologic reactions. So this is just to differentiate, because when you hear reaction and process in terms of pathology, they might sound similar, but they're not the same. So a pathologic reaction is a transitory. In short, this is what you should note here when it comes to reaction. It's just transition, yet it is not, you've not really defined the pathology. This is just a transition state, and that is, remember, it's a reaction itself. And in that, at this stage, you have an inadequate answer to the kind of organism that's causing that reaction. So that's what pathologic reaction is. It could be anything, just a reaction. The reaction could be what? Just maybe goosebumps. It could be sneezing, it could be redness of the skin, and all of those things. You can't actually identify the kind of organism that's causing that. Meanwhile, for pathologic process, now it is a regularly emerging sequence of changes in the organism. So now that pathogen has now dwelled there in your system, and then it is now beginning to incubate. Remember, we saw the whole pattern of, excuse me, we saw the pattern of disease reactions over there. So it's similar here. It will incubate itself, begin to reproduce, begin to spread out, and then start to cause systemic effects. So that is pathologic process here. So that's the difference. At this point, you're even able to detect the organism, because when you take blood sample and all of those things, it will show clearly on the blood sample that, okay, these are the organisms, or this is the organism that is causing this disease condition. So we'll see the questions relating to that, and then we'll try to answer. These ones are just, remember, we've talked about this oftentimes. These are white blood cells. That's leukocytes. And then there are 5 of them. Leukocytes will have the fields and then the sites. So for the sites, we have monocytes, lymphocytes. For the fields, we have neutrophils, eosinophil, and basophil. So these are just the functions. It depends on the kind of reaction, depends on the kind of organism causing the disease condition. So if it's bacteria or fungi, or removal of foreign debris, then we'll go for what? Neutrophils. Neutrophils actually are the ones that take charge of this kind of reaction. Then the others will still maintain. However, if it's monocytes, monocytes are just trying to clean up debris, and monocyte is an after infection. That suggests that it is an after infection. It is trying to clean up the wounds, the scars that have been caused by this by a disease or by pathology, by pathogen. They have eosinophils that take care of what? Parasites, cancer cells. They have lymphocytes that fight antibodies. then basophils that are what responsible for allergic reactions. All right. So that's briefly about some little explanation. We'll start with the first question here. Here it says a clinical examination of a 52-year-old man revealed dark red gums of the upper jaw, suppurations from the gingival pocket, that's those spaces on the gums where the teeth fill in. From gingival pockets, loosening of the teeth. The illness was diagnosed as parodontosis. What period of illness is it? So in this case now, when I refer to parodontosis, it is just an inflammation of the gums there. Yeah. So
Is
what
it
period of,
prodromal?
okay, no, not prodroma. But remember what I told you about prodroma, right?
Yeah, it's after the incubation period.
Yeah, just after incubation, but that is not at this period. Incubation, the disease is just trying to develop, to grow and multiply in the system. But then prodromal is just okay, fine. The disease has now incubated and it is trying to cause the actual problem. But the peak, when you compare the features you have there, because
Period
they were
of illness.
specific, yes,
But
they were
there they mentioned
specific.
something pre-illness, not period of illness.
Where okay, I mean the option
Yeah.
pre-illness.
Yeah, pre-illness, it's before the illness. But I have also a question. Please, can you
Okay,
go
you
back
mean
to
option A.
yeah.
Okay, I'm
The
coming.
outcome
What's the question?
is the outcome of the disease means if the person has recovered or not, or what they have discovered in the disease, like now parodontosis.
Yes, what they have discovered, it is certain that this is what is wrong with the person. This is diagnosis.
Ah, okay, okay, now I
Yeah,
understand because I thought that it is after the recovery. It's like a recovery
no,
period.
no.
Oh,
So
it's
this
E.
is not E, not E. I'm coming. I'll explain that little by little. So there's already a diagnosis here.
Yeah.
There's already a diagnosis here, and what we are being told is what? Okay, first of all, look at the features that we're given. They said there's a revealed dark red gums of the upper jaw, suppuration. That's this. The location is what on the jaw, isn't it? On the gums, I
Yeah.
mean, of the upper jaw.
Gum.
Then suppurations of the gingiva. This is still about the jaw. The sorry gums, isn't it?
Mm-hmm.
And of course, the teeth are attached to the gums, and then there's loosening of the teeth. So it was not diagnosed, like it is now definite and accurate that this is what is wrong with the person. So all of this will be suggestive of the actual period because now you don't have one symptom, you have multiple dark red, you have suppuration, that's pus, and then you have loosening of the teeth. So this is the actual period of the illness itself that you will suggest or you will think of because that's the peak. You can see on this slope, the peak is when you will have the utmost symptoms and signs being manifested. Do you understand?
Yeah.
So rather than saying the outcome of the disease, if you were just told that this person has, you are not giving all these features, but then you are told maybe the person just has parodontosis. Yes, that's just the outcome of not even no, this is not even the outcome, this is still a disease because it's diagnosis. But the outcome could be that what out of all these features that were given, they'll tell you something like, okay, he had difficulty in eating, or no, not before difficulty in eating, maybe he lost weight. You'll be told that there's weight, loss of weight, and then you start thinking, okay, loss of weight, these problems are with the gums, but why we talk about loss of weight? Obviously, if there are pains and pus on the gums and losing of the teeth, the person will have difficulty in eating, right? First of all, as you're having difficulty in eating, then you won't have enough food to eat, and then before you know, you start to lose weight. So the loss of weight um, can be the outcome of this condition. Then another outcome can be okay, there's dark red gums, there's suppuration, maybe jaw swelling. Jaw swelling. Yes, that could be an outcome again. It is on the gums. The problem is on the gums, but then there's still jaw swelling and jaw pains. So all of these are outcomes. So anything outside the actual features you are being told here, that will suggest the outcome. But all of these are just telling you that this is the disease condition. These are what are being manifested. That's why it will be better to go for the actual period of the manifestation. Pronounced even. There's this word pronounced. It means very clear and definite period of that disease condition. Jaw pains or swelling. All right.
Does option A means also period of incubation?
Yeah, it could be both either period of incubation or okay, there's prodromal here. So yeah, just period of incubation. That's pre-illness, before the illness. Yeah. So
And
this will
the
mean
option B?
sorry,
And the option B?
I'm coming. Incubation period. Option B is latent. Latent means yeah, latent is similar, is in between pre-illness and prodromal. Now, latent still means that the disease or the pathogen is there, but there's no manifestation yet. It could be just fever, sorry, general signs, general symptoms, like what fever or headache can just be there.
Okay, one last
Fever.
question, please.
Yeah.
So the outcome here, it means the effect of the disease
Yes.
on the patient. Okay, got
Yes.
got it.
But here you can see the question we're talking about the actual where that problem is. That's what the question is centered on, not going as far as talking about the person's weight, the person's feeding habit, the person's maybe the excretion, the kind of excretion that is being passed out.
Okay.
So that will be just the outcome of this condition. All right. So question 2 here. A 55-year-old woman has got some caries, that's caries, teeth caries. What is the proper nosological term to determine the state? I told you about the reaction and the process, isn't it?
Yeah.
Yeah, the reaction is just telling you that okay, there's something on, but it's not definite yet. But here they're telling you that it's definite because teeth caries. This is the tooth itself. Then you'll find the caries somewhere around here at the base of the teeth, just before the gums. These are the gums. These are the gums. This is the teeth. So you'll find some dark coloration around here. That is the caries you have here, the teeth caries. So this is also definite. By the time you see that, you know that, okay, this is a definite pathology. Unlike the person just presents you with what, you know, people that have gum or teeth problem, they present with what? Pain, isn't it? Gum, jaw pain, or jaw swelling. So those ones could not be a reaction to what is happening here. So this could be jaw, let me just put in general, pains, fever. This will be pain, fever. These are just reactions. But then the process itself is what you see on the teeth, which is the caries itself. So that's why the pathology process is the caries, teeth caries itself.
Can we also take the gums inflammation as a reaction here, or it is a process?
Yes, it will be a reaction,
Oh,
gum inflammation, because it's not definite. Even the gums, you can have gingivitis, that's gum swelling. You can have dental caries, you can have dental plaques. So it could be anything too, but just swelling is not definite. All right, a man has worked in a thick uniform in summer who manifested a high rise of the body temperature with what? Dyspnea, tachycardia, dizziness, cramps. Then he fainted. What is the cause of this serious state? Now, this will be practical. Imagine you are the one, isn't it? They said, well, the person wore thick uniform in the summer. What happens in the summer? There is heat, and they are now
heat.
wearing thick uniform. So because of the heat, you're expected to lose heat from your body through what evaporation on a normal basis. But then you're wearing very thick clothes, so you cannot lose the heat through what? Through evaporation. So that's the same condition here. This person, because of that, he couldn't lose body heat, and then he started developing what dyspnea, that's disturbance in breathing, tachycardia, dizziness, and cramps. Then he fainted. So what do you think will be the cause now? Will it be decrease in heat production? Is there any decrease in heat production? Do you think so? No. Is there
No.
intensify?
Sorry.
Is there any intensifying of heat production? Yes, there is, but okay, let's leave that aside first. There's intensified heat production, but that was not the reason why he felt dizzy. We'll look at the other options. Intensifying of heat emission. Also, let's keep that aside. Then decrease of heat emission. Yes, obviously there was heat production, isn't it? But it's a normal process because you're supposed to lose that heat through any of those four methods: conduction, convection, radiation, or evaporation. So intensifying heat production is not going to be an issue at all because it's a normal process. Intensifying heat emission, obviously no, because there was no heat emission. Why? Because of the thick clothing he was wearing. So there was no heat emission at all. But decrease of heat emission, definitely. Why? Because of the thick clothes. So the heat was still conserved in the body, and then it was too much for him. That's why it led to that. Then the other option is what heat emission is equal to heat production. That is not because it would have been normal in terms of heat emission being equal to heat production. Are we together?
Yeah.
And in short, this will lead to what we call dehydration. When there's intensified heat emission, it can lead to dehydration also. So when the question is also suggesting dehydration, that means there's high heat loss. Because the heat loss will be through sweating, and then there's no water again in the. That's how you find you become thirsty more often during the heat season. All right. After diving at a depth of 30 meters, remember what I told you about greater than, sorry, 60.
It's
Remember what I
60.
told you about greater than 30 meters? Yeah. A diver develops such symptoms of CNS dysfunction. This should be suggestive of something already. With what? Euphoria. That's that sensation of happiness, typical in those that drink. Then weakened attention, that is short attention span. Then making professional mistakes, that's unstable. Which substance causes toxic action in the neurons? What's the substance?
Nitrogen.
Okay, nitrogen is it. It is. An electrician touched a bare wire of electricity cable with both hands and died. What was the cause of death? What do you think will happen? Let's still make it practical. When one touches electricity
Fibrillation,
with high.
maybe?
Okay, why is it fibrillation?
Because now we have electricity, so it will disturb the normal sinus of the heart, the sinus rhythm.
Okay, okay, perfect. So first of all, remember what the heart structure looks like this way, and then we have the SA node here. We have the AV node. I told you the heart is the last organ to die because it doesn't depend on the brain. It can generate its own electricity, which is starting from what? The SA node, spreading to the AV node, and then coming down through the other heart structures. Now, I know maybe you must have seen this in movies when there's a patient who is about, so doctors are about losing the patient. They do what? They use what we call defibrillator, right? They are two like this with handles, and then you hear them say clear off. They place on the chest of the patient. They don't, if you check very well, if you look very well, this is how they place it. If this is a patient, sorry, just a rough sketch. They place the defibrillator one one here, sorry, one here and one here. They don't place side to side, they don't place in the same horizontal line. One is up. That is, they are trying to channel what? They're trying to locate, or they're trying to align the defibrillator with this SA node and AV node, the way they are being placed in the heart. You know, it is slanty, it is not straight. So by the time they press the defibrillator, they induce the electric current, which then go trying to charge the SA node and trying to charge the AV node. Then the person's heart can then pick up. But if it doesn't happen, they try and try and try. Eventually, the person, they know that the person is dead already. So that defibrillator is what is inducing the electric current, and that's what we call fibrillation of the heart. Also, this SA node trying to generate current, electrical current, and then transporting to the heart, to the AV node, and then down to the other channels. Is still fibrillation of the heart. So in this case now, this is what talking about bare electricity cable with both hands and then tied. The obvious thing is what do you expect from electric cable to be electricity definitely, and that's another way to charge the heart. Although that's too crude because it's not measured, it's not well defined. So you can give very high voltage or very low voltage. However, you're risking the person's life to death. So, well, the cause of the death is just as simple as what? Fibrillation of the heart, because that's what the electric current is causing. Are we together? Let me label this defibrillator. Okay. Then question 6 here. Low temperature stimulates the activity of thermoregulation mechanism in the body. Which mechanism emits emission most efficiently? So in this case now, there's low temperature, first of all, that stimulates activity of thermoregulation. You know, when there are thermoregulations, these are like your adaptive mechanism of the body to maintain homeostasis. You have to maintain homeostasis. So if there's high temperature, your skin actually, which is the first to pick that, tries to adapt. Also, if there's low temperature, your skin tries to adapt. And by doing so, it does that by what? Either increasing or reducing the blood vessels around the skin itself. I mean increasing or reducing the size. So if there's increase in size, this is the blood vessel, right? And then imagine the temperature is now high. Imagine temperature is now high, and then you try to expand this. No, when I say high, I mean, of course, it is hot, like in summer. And they are trying to expand this. You are trying to expand. Why? Because you remember that heat is being transported through the blood also. So this vessel will try to expand so that to allow more of the blood to flow properly and faster to other regions, just to transport the heat throughout the body so that it won't be just in one place. But then it is opposite in the case of what? When the place is very cold. When it's very cold, you try to narrow so that even the areas in your body that there's heat, it won't go and it won't spread out so quickly. Take, for example, of course, you're wearing clothes, maybe short sleeves, your forearms are opened, and you're wearing shorts, your legs are also exposed. So during the low temperature, those areas that are covered with clothes actually have warmer temperature than the other areas that are being exposed. So in low temperature, what the skin does is what the vessels around it tries to constrict the vessels, that is make it narrower, so that even the even the warm temperature in other regions will not spread so quickly. It will still try and conserve and be conserved in your body system to at least keep you a bit warm. But if it is expanded, then the heat will transport quickly, and then before you know it, your whole body is cold. So that's how the body tries to maintain to regulate temperature, the skin, I mean. So there's low temperature in this case, and then this activity of what thermoregulation mechanism in the body, which mechanism limits the emission most efficiently. Like I just explained, what's constriction of the vessels around the skin. So this simply means that's angiospasm. Angio means vessels, spasm means constriction. So constriction of blood vessels around the skin. In what case do we have vasodilation? Who can answer that? In what case will option D be the answer? When we have high temperature, like I just explained, high temperature, and then the skin is trying to transport the blood, I mean, is trying to transport that heat immediately so that at least to go down and even lose that sweat. So there'll be dilation of the vessels around the skin. All right. During the liquidation of coronary catastrophe consequence, A worker received a 5-gram dose of radiation. He complains of headache, nausea, and dizziness. What kind of changes of the leukocytes formula will take place in 10 hours? Okay, yeah, that will take place in 10 hours. So first of all, there are two methods of approaching this question. I tell you the functions of all of these white blood cells, isn't it? The leukocytes. I just wrote the function there. They are up there at the first page of this lecture. Secondly, when it comes to this, when it comes to this, sorry, when it comes to the radiation itself, 3 grams of radiation affects the blood closely, and then 4 grams affect lymphocytes. It will reduce reduces lymphocytes, and then 5 grams will then reduce neutrophils. So in this, going by this explanation, this is a bit abstract because I'm just talking about radiation in terms of the 3 grams, 4 grams, and 5 grams. Now that aside, now obviously with what I've written here, the answer is going to be what? Neutrophilia. Neutrophils are affected here. But that one aside, let me go back to the functions of those white blood cells, and then we'll see something. Now, when you compare, I talk about some grams of radiation, isn't it? Some grams of radiation.
Yeah.
Is there anything suggesting that we're trying to clean up a debris? No. So this is not monocytes. Is there anything like parasites or cancer cells? No. For now, although even the radiation later will cause cancer.
But we use,
So,
yeah, exactly. We'll come
yeah,
back to it.
later in life it will cause cancer, but not immediately due to the exposure. Then I will talk about allergic reactions here. Obviously, no.
No.
I'll talk about viruses or viruses or antibodies. No. I'll talk about bacteria, fungi. No. But however, the foreign debris itself is what comes with this radiation effect. Yet, these monocytes are going to clean this debris later, but the the, the debris um, being accumulated or deposited there in the system is what we refer to just as foreign debris at that moment. However, in the period of recovery or healing, the monocytes can then come up and just mop or clean up that area which has been treated. So foreign debris in this case will come from the radiation itself, which is as a result of all that Chernobyl or whatever they call it, the Chernobyl catastrophe sequence. So there'll be some drops of all of these radiation doses there, and that's what we'll still term as the foreign debris that are coming in this case. So that's the second reason why neutrophils will be the ones to what react. Will be the ones to react in this case. Okay, question is done.
Sorry, here the radiation was due to what?
The radiation,
Yeah.
this Chernobyl catastrophe here. This coming from an implant, from nuclear implants, power plant, I mean.
Mm.
Yeah, I think there's a story about this in Ukraine, so I didn't really read that. That was the first time there was an invasion, 2014. No, 2008 in Ukraine. All right. Someone asking a question? Okay. While climbing a mountain for several days at an altitude of 5,000 meters, a mountain climber felt tachycardia, that's increased breathing, increased what's it called? Heart rates. There was headache, dizziness. What are the symptoms, condition? What are these symptoms conditioned by? So what is the cause? What do you think happens when there's
B,
mountain climbing? Okay. What is
because
what is
at high
the
altitudes we have less oxygen.
exactly partial pressure of oxygen is decreased.
Yes.
Decrease partial pressure of oxygen. So that's the reason. All right, a man was admitted to a hospital 3 days after being exposed to 3 grams of dose of ionizing radiation. 3 grams of dose. Now that's why I had to explain the 3, the 4, and the 5 grams of radiation. What physiological system is damaged most of all cases? Now, before I even continue, I have not read any text that has actually explained how they got these direct figures with the systems they affect or the structures they affect. You understand? But since we're preparing for exams for now, we'll just go with these values, the 3 grams, 4 grams, and 5 grams going forward. 3 grams for blood, 4 grams for lymphocytes, and then 5 grams for neutrophils. However, the Krok will not go more than this. You won't see 8 grams, you won't see 10 grams, and all of those things. So just stick with what we have here, and then you know what to pick. All right. So 3 grams here is for what? Blood.
Blood.
During an emergency rise from the depths, what does this tell you? Is it a skydiver or sea diver? Rise from the depths. This is a sea diver, obviously, isn't it? Because you're coming, you can't rise from the depth. Depth means deep down, means down. So you're rising now, that means the person is coming from out from the water or the sea. A diver developed convulsions and unconsciousness. What is the basic pathogen mechanism of such symptom? What is it?
Is it gas embolism, as you
Yeah, what
explained?
gas? What gas in particular?
Is it gas embolism? Can you hear me?
Yeah, gas embolism.
Okay.
Yeah. But then when you look at option D, there's what we call what the toxic action of nitrogen, which could be, but in this case, it is not, this is generalized because the nitrogen could go into any other system. But here we're being concerned about the blood system itself. So embolism can only talk about, that's why I started by defining what embolism is. It could be an accumulation of some substance there in the blood vessel leading to the inflammation of the vessel itself. So by so doing, it will get, of course, it is inside the blood vessel and then it is passing along with the blood. It will then go into what? The brain. That's when to cause all the CNS issues. But when you talk about toxic action of nitrogen, you could have it as a respiratory problem. You could have it that's outside the cardiovascular system. You could also have it in the respiratory system. You could have, in short, a form of nitrogen that one inhales and then it gives what? That laughing gas. We call it laughing gas, and the person begins to laugh uncontrollably. They could also have it maybe in the GIT system also. You could also have it in of
Um,
nitrogen. It's too general.
as earlier.
It's generalized.
Yeah, it's not a toxic process reaction. It's a normal process that occur during skydiving or sea diving.
Yes, when person has gone
Yeah, so
below,
we don't
yeah.
we don't consider it as toxic reaction, right?
Yes, in this particular question, like I said, the only reason is toxic action of nitrogen makes it general because it will affect so many systems here. But these systems we were referring to as when I talk about nitrogen necrosis is what's specific to the CNS problems that are being shown. And it starts from what? The blood vessel, because it is through the blood that this nitrogen is then being transported to the brain itself. So gas emboli and nitrogen. Okay, the other question we saw there already that we answered, they asked about the gas. We answered nitrogen. Here they're not talking about the gas, the particular gas. They just asked the general term, which is gas embolism. Okay. Here we have 4 grams. What will be the answer?
I think lymphocyte it was for 4 grams or no?
Yeah. lymphocyte.
Yes.
A driver had stayed at a depth of 40 meters, actually greater than 30, for a long time. While surfacing, he developed Caisson disease. Okay, and I forgot, I'll still write it there. Under the decompression, what kind of embolism is the underlying cause of this disease? So, okay, what do you think about this? I know you don't know what Caisson disease is, but it's the other name for that disease condition. Before we go ahead, what do you think will be the problem? Because here they're asking
Is
what
it
kind of embolism.
the same problem with nitrogen embolism?
Yeah, nitrogen.
Yeah, yeah. So the embolism will be nitrogen embolism. So here is the answer. Okay, well, 2 pages down. 3. Well, yeah. Okay, yeah, nitrogen, but here they are asking kind of embolism. So it's still gas embolism. If the person was a skydiver, definitely to be air embolism, like I did explain earlier on. So Caisson disease is the other name. Let me write it there quickly. Caisson disease. Okay. So before we go ahead with the other parts of those questions, we'll talk about some basic things again. We'll try to revise. This is what we call the chromosome. The chromosome, of course, you can see from this diagram, this is a cell, right? And in the cell, we have the nucleus. And the nucleus contains chromosomes, millions of chromosomes. But this is just one chromosome that's being brought out for study's sake. So the chromosome, what does chromosome do? Chromosomes are the ones that actually carry DNA and genetic information all around, where you have all those adenosine. Okay, here they are, those nucleotides, the 4 of them. Adenine, cytosine, excuse me, thymine, guanine. Although this aspect of pathophysiology is not completely all about pathophysiology, it's more on med bio. So that aside, that's all about the chromosome. I need you to remember. Then here we'll have what we call, what do you call this?
In the karyotype?
Type, yeah, exactly. Thank you. This karyotype. So this karyotype is a genetic form of investigation where we check disease pathologies. Now, normally there's supposed to be pairs of this chromosome you're seeing here. They're supposed to be in pairs. This pair 1, pair 2, pair 3, down to 22 pairs of the autosomes. We call them autosomes because they're the normal chromosomes. And then we'll have another pair which is for the sex chromosomes, either X and Y for a male or X and X for a female. To start with, let's particularize this. What can you say on this? I remember when we were doing pediatrics in 3rd year. Yeah, they at Sumi. We go to the class and then the teachers, they pick so many karyotypes and give us and ask us to talk about the karyotypes, what we can see. I mean, yeah, the karyotype itself, what we can see there. So first of all, what gender is this? This karyotype is for what gender? What do you think?
Male?
Why?
Isn't
Any
it
reason?
XY?
Yes,
Oh,
here's
sorry.
XY, that's the sex.
Yeah, it is
Here's the
XY,
sex
right?
chromosome. Yes. Okay, it's not clear for you, right?
No, it's not. I'm just guessing.
Okay.
It's blurry.
So this is a male. This karyotype is for a male patient. So that's the first thing you're supposed to take note of. Then secondly, you look at all of these. All of these chromosomes are supposed to be paired. So when you find a chromosome number that has a default, they're supposed to be 222. When there's a default means that what? Maybe this is normal
There's
shape, right?
yeah.
It could be absent. You could have just one instead of it, 2, or you could have 3, right? Or you can have one and then the second one will just be small, like this half. That's like depletion. That's what they call the chromosomal change, which is called depletion. You can have translocation, although you can't see translocation on karyotype. But these are the obvious ones you can see: single, triple, depleted. You understand? So now I'm just trying to help you understand this because when we talk about trisomy 21, if you hear trisomy 21, you just think of Down syndrome. If you hear trisomy 18, you think of Patel syndrome. If you hear trisomy, what do you call the other one? Sorry, if you hear 13 is Patel syndrome, or you hear 18, you think of Edwards syndrome. Now, this is how they discover those things. In Down syndrome, you see 21 is here, right? This is number 21. And they call it trisomy. That's the three somies of 21. What you see on this Down syndrome is 3 chromosomes instead of 2. Do you understand?
Yeah.
On the Patel, you will see what? On the 13th chromosome number. That's where you see the third one. Patel, that's 13 here. And then, of course, Edward, you sit on the 18th chromosome. Then there are some other chromosomal abnormalities like Klinefelter syndrome. That one, the sex chromosomes too are supposed to be paired in twos. But then Klinefelter, which is for male, you have another chromosome here, which is the X, so XXY for male. Or if it's Turner syndrome, which is for female, you will have something like all of this will be. You have still 3 chromosomes, sex chromosomes, but it will be X, X, and X. All of them will be X. And of course, anywhere you see Y, just know that is a male. No matter how many X are there, so far there's a Y, that's a male. If there's no Y, it's a female. As simple as that. All right, so that's karyotyping. And that's on this karyotyping. Okay, there are some disorders of these chromosomal diseases, which are what? These are the common ones we know. Trisomy 21, which I just mentioned, trisomy 18, Edwards syndrome, then trisomy 13, which is Patel syndrome. And I normally give this to help you remember. Election, puberty. Let me start with puberty. Election, and drinking. That's alcohol. So just to help you remember, puberty starts with P, and that's the age for the puberty, where there's a range, a little range, but 13 is considered normal for ladies to attain. Not for men, I mean for boys to attain puberty. So puberty, which is P, is for 13. That's 13 years. And then election, in most countries, they use the age 18 to determine an adult. So by the age of 18, you're an adult, and then you can go for elections and vote or be voted for. So 18 is for what? The E. And then we'll have drinking. At the age of 21, at least you are adult enough, you are mature enough to handle yourself, to control yourself in terms of the amounts you drink, or to control yourself when you start misbehaving. So the drinking itself is for 21, at the age of 21. So that's what we used to remember. This P is Patel 13, E is election, that's the Edwards syndrome, that's 18, and then D, which is down, is 21. All right. So these are the 3 common ones. Then the other ones could just be Turner syndrome, which means there's what? A single X chromosome. This is monosomy, that is 1. Mono means 1. So monosomy is X chromosome, 1 chromosome of X on the female. And then there's Klinefelter syndrome, which is 2 X chromosome. You can see it here. It's supposed to be XY, but here you have XXY, and it's normally what's in the male. Then you have triple X syndrome. That's we call that alpha females. Alpha female. The females are extremely females. They have, of course, the characteristics of females. They have it in excess. Talking about the emotional instability. Talking about some maybe the whatever it is actually, the breast development and enlargement, the hips enlargement and development, all of those things, they have it in excess. Those are super or extra ex those are super females. Yeah. They also have XYY syndrome. Here, this is rare, but then you have 2 Y chromosomes, just take note of that. So that's another aspect. Those are the disease conditions. Now there's this Did I put telangiectasia and okay, yeah, they're all there. So there's what we call mode of inheritance. Mode of inheritance means, all of these chromosomes are being transferred from parents to offspring. So there are different modes of this inheritance. There's what we call the autosomal inheritance and then X-link. Autosomal means it affects both male, it can affect both male and the female, while the X-link is just affecting what is just manifested on the male, but is being X-link. Remember, the male has X also together with the YX. Those disease conditions are not manifested in the females. However, females are carriers. Take, for example, color blindness. It is known that men are the ones that are colorblind and then females see more colors. But however, these traits are being transferred from females to their sons, from mothers to sons. So mothers are carriers, but doesn't manifest in them. It only shows in the male. So by the time if my mom transfers that to me, it doesn't manifest in her, but it manifests in me, and I'm not able to see those colors. At the end of the day, at the end of the day, I also transfer to my daughters. It won't manifest in them, but will transfer to their own sons. So that's what X-link is. Now, aside this autosomal and X-linked inheritance, we have what we call dominant and recessive. Now, wherever you hear dominance from the word dominate, it means across every generation. This is generation one, this generation two. If this were going to give birth to their own children, this would be the third generation. So to your grandparents, you are a third generation. Your grandparents are the first generation, starting with your grandparents, I mean. Your parents are second generation, you are the third generation. Your own children will be the fourth generation. So if the disease condition cuts across every generation, that is what the dominant gene. But if it skips a generation, like what we can see here, this dark color means this is an affected person. So you can say in this generation we'll have, this generation will have, but here it is only in this generation, second generation, we don't have it in this generation. So it is recessive, that's skipped. So also the same thing with the X-link. You can see here, it is present in this generation, here in this generation, but not in this generation, and then present in this generation. So that is the difference between recessive and dominant. Okay. So there's another one we call telangiectasis, also called Lewy-Body syndrome. Lewy-Body syndrome. I won't bore you so much talk. This is another disease condition. This is the skin. What you have here is what the vessels around the skin are actually protruding, and then they are appearing reddish or like spiders. So there's a triad. There's what we call triad of this disease. Wherever you hear triad, it means these are the classical features you'll find in this disease. The first one is what? Ataxia. The second one is what we call, or is referred to, the reduced immunoglobulin A or T lymphocytes. And the third one is the spider angioma. Spider angioma. So this spider angioma is what we can see here on the skin. Yeah. It's also scleroderma, kind of referred to as scleroderma. Okay, so what else again? Ataxia is reduced or problem with the gait, as when walking. All right. Then there's another syndrome we call Digest syndrome. Also, now, when you hear Digest syndrome, this is what I want you to do. Wherever you hear Digest syndrome, whether in Krok or in your practice or wherever, just remember this catch 22. Excuse me, to help you a lot. Catch 22. What's 22? Okay, what catch means is what? C means cardiac malfunctions, A means abnormal phase, T means thymic hypoplasia or agenesis, that's thymus, problem with the thymus. C means cleft palate. Then there's hypocalcemia, that's reduced calcium in the blood. That's the catch for you. Then 22, there are different on the chromosomes. On the chromosomes. Okay, let me use that same picture I have here about the chromosome. Remember, is what? Catch 22, right? So it means on this 22, here's 22, right? There is a deletion on one of the arms or one of the chromosomal legs. Now, this is one chromosome, this is another chromosome of 22. But in Dajor syndrome, what happens is what? You have the one number one, then there's a deletion, I mean. This is normally called, the upper part is called the short arm, and then the lower part is called the long arm. So there's a deletion of the long arm of one of the chromosomes on 22, on the number 22 of the autosome. So that's what Dajor syndrome is. So that's the first thing that should come to your mind. Once you remember catch 22, you know what they're talking about in general. That's when you have the features of all those other things. So I won't go into details. Catch 22 has covered everything on that Dajor syndrome. Then we're supposed to have Bruton syndrome somewhere. Bruton syndrome. Okay, I didn't include it. Let me see. Okay, Bruton syndrome. Let me just write it quickly. Bruton's disease. In this disease, there's a problem. There's a reduced what? B lymphocyte. Take note of this difference. Here I'm writing what? B lymphocyte. In Lewis-Barr syndrome, what did I write? T lymphocyte, isn't it? It's here. T is for Lewis-Barr. B, Bruton starts with B, and then you have B lymphocyte. So that should help you remember. And then this is also an X-linked disease. That's all you need to know about this disease condition concerning Krok. All right. This pathogenesis, I mean, of HIV infection. Pathogenesis of HIV infection. Pathogenesis. Here is just talking about how this disease or how this virus can go into the system itself. Remember, there are different cells that cause what? That cause reactions that react to disease conditions. So CD4 cells are the specific immune system cells that actually react to the HIV infection itself before all of these occur. So I don't know if I should go down to explain deep, but I think, okay, when we start answering the question, we'll see that. Then there's what we call what's the immune system. Here's the immune system. So this is a bit, okay, let me take it down. I think this is better. Okay, this is okay. So the immune system itself. The immune system, there are different barriers. There are different structures of the immune system. First of all, immune system is divided into two: innate immune system and then adaptive immune system. So the innate means the ones you are born with. Anything innate means you are born with that. Like your character, your skin complexion, those are innate. Adaptive will be the one that you try to modify as you grow up or as you try to develop. So the innate immune system are what? Barriers like skin. You are born with your skin, obviously. You are born with the mucosal layer of your GIT to protect also even your lungs too. They have those chemical barriers too around your eyes to secrete tears. Those are all barriers that help to what? Fight or that try to stop infections from coming in. Then the cells actually that are part of this innate are what? Mast cells, neutrophils, macrophages, and the natural killer cells. But for the adaptive, these are the ones that, as a result of what? Responses, they begin to form. So we'll have under this, we'll have what? T lymphocytes, we'll have B lymphocytes. These ones, you are not born with them. They only try to develop as more infections do come in. Take for example, nobody was given birth to in this generation. I mean, was given birth to with COVID-19 antibodies. So that's how we had to do take vaccines so that our bodies, the B lymphocytes, will produce antibodies for the COVID, and all of those things. They also have CD4 and CD8 for those infections. So those are the cells. All right, this is just to differentiate between glucocorticoids and mineral corticoids. Glucocorticoids, let me see what aspect of. Okay, they are anti-inflammatory. Yeah, they are anti-inflammatory molecules actually that help to modify the expression of. Okay, first of all, they are produced by the adrenal glands, as you can see here, which are on top of, sitting on top of the kidneys, and then they are used to. Um, they're anti-inflammatory, of course. So that says it all. Anti-inflammatory means they try to reduce or stop inflammatory reaction because when infection is coming, your body tries to respond with inflammation. So the glucocorticoids, which could be drug substances in this form, can be given to stop the inflammation. However, for mineral corticoids, they are they help with the absorption of some ions, water, and proteins there in the kidney, and then to excrete them also. So the mineral corticoids are more channeled to the kidney, while glucocorticoids are in general where you have inflammation. Can you guys still hear me? Because it's raining here and then it's a bit noisy. Hello? Can you guys still hear me?
Yeah.
Yes, we can.
All right. So the last aspect we'll talk about will be okay, these are types of hypersensitivity reactions. Hypersensitivity reactions. What are hypersensitivity reactions? These are reactions that occur due to response to some pathogens or organisms. And they are called hyper because they are responding with exaggerated, they're giving exaggerated response or giving reactions that are being, I didn't read this complete, or reactions that are being exaggerated. So hypersensitivity reactions. Yeah, like I just said, they give exaggerated responses to infections. So here, this is a mnemonic I'm writing here for you. Not a mnemonic actually. Here's an abbreviation for you to remember. Now there's type 1, 2, 3, and 4. So the way I wrote this word acid, whenever you hear hypersensitivity reaction, the first thing that should come to your mind is the word acid. So type 1 is for A, type 2 is for C, type 3 is for I, type 4 is for D. And what does A means? Anaphylaxis. Anaphylactic. C is what? Cytotoxic. Anaphylactic reaction, cytotoxic reaction. I is what do you call that again? Immune mediated. Immune mediated. And then D is for what? Delayed sensitivity. So whenever you hear hypersensitivity reactions, remember the word acid, and then you try to arrange them in that order 1, 2, 3, 4. Shortly, we'll look at what all these reactions are. This is what it is on the summary on this table, but we'll not go deep into that. Then serum sickness. No, I'll leave that one for now. And these are different types of antibodies. 5 types of antibodies: A, D, E, G, M, and their various function. The antibody A is for what? Okay, this is where they are found, and then they protect against pathogens. Antibody A, pathogens. They are found in saliva, they are found in breast milk, tears, and all of those things. Antibody D activates B, that's basophils, and mast cells. So these ones then go further to provide what? Antibodies, to produce antibodies. Antibodies. The anti immunoglobulin E, sorry, they are the ones that are being responsible for what? Allergic reactions. So any allergic reactions, whether hay fever, the sneezing, pollen, whatever it is, any allergic reaction, it is as a result of the IgE. Then, if I let me put to you now, some people have allergy to food substances. Why? Because they don't have the IgE responsible for those food or the enzymes, the IgE that's supposed to control the enzymes that react to those food substances. Take, for example, lactose intolerance. The IgE are not there, and there at the same time, the enzymes to help break down the lactose are not there. So that's why when person ingests lactose, it is not being digested in the stomach. That's how the person passes it with stool. So the person begins to develop what? Because it is not digested, it's not broken down. The person begins to produce what? Watery or diarrhea, watery stool or diarrhea. They will have IgG, which are able to what? Cross the placenta of the fetus, sorry, cross the placenta into the fetus, and they secrete what? Plasma cells. These are cells of the blood system itself. So these are the genesis of the blood plasma that the mother passes to the what? Fetus. Then we have IgM, which is attached to the B surface of the B cell that secretes into the blood, responsible for early stages of immunity. IgM is for immunity. Okay, that Bruton disease I talked about earlier on. I thought I didn't put the picture. Here it is. So that Bruton disease I told you, for the Bruton disease, it is a problem with what? Who can remind me? What kind of lymphocytes?
Was
B
it
for
T?
Bruton. Yeah, B lymphocytes. And then what kind of disease pattern does it follow? It is X-linked. All right. So the other information here, I just added information. Okay, there's still, it is written here already, B, mature B cells. All right. Comes test. Well, we'll see the question that relates to that, and then we'll see if we can answer it. All right. The first question should be 13 here. So a doctor consulted a woman. A doctor consulted a woman and with defects of physical and sexual. First of all, the patient is what? A woman, isn't it? With physical and sexual development. Microscopy of mucosal cells in the oral cavity did not reveal any sex chromatin in the nuclei. What kind of chromosomal pathology does it? So what diseases are peculiar with women here? For now,
Trisomy
Down.
on X also.
Sorry?
E.
Okay, E. I don't know about this. I've never had this. This is the first time I'm hearing this. But Klinefelter is for men. Klinefelter is for men. Turner is for female. So now, there's nothing to suggest there is Down syndrome, isn't it? Nothing about all of those features of Down syndrome or trisomy 21. No. Look at what they said here. Microscopy of mucosal cells in the oral cavity did not reveal any sex chromosome. Did not reveal any sex chromosome. When it says trisomy X chromosome, it means that what? You know, a normal
X.
woman is XX. But when you say trisomy, it means it is XXX, isn't
X.
it?
Oh, it's not bored.
However, yeah, but in this case, they said did not reveal any sex chromatin in the nuclei. So obviously, it means that this person has one, instead of two, person has one chromosome. And that's the feature of the Turner syndrome.
Missed one, yeah.
This is Turner syndrome. You can say monosomy, isn't it?
Yeah.
That's why it is monosomy. That's Turner syndrome. Now, thank God those things are there in brackets, so I take notes. In case tomorrow they don't write Turner syndrome, they write monosomy. You should know that, okay, yes, at least you are still in line. So, in brackets, mo, no, so me here. All right. What method of genetic examination most likely makes it possible to diagnose Turner syndrome? Now, for it to find, because it's a problem with the chromosome. So, how do you think I even find out the chromosome? It is what? Karyotyping, isn't it?
Yeah.
Yes,
It's supposed to be karyotyping, but there's no karyotyping here. So, what do you think is close to karyotyping here?
it's C or A, maybe.
Okay, it is C. You can see in our previous question, they used this term to explain the question. They said the sex chromatin was not found on the saliva, isn't it, on the mucosal lining, isn't it?
Yeah.
So here just twisted, it's still the same, it's similar. Here it is, sex chromatin. Can you see it in the nuclei?
Yes.
The same thing here. So it's just trying to identify the sex chromatin, which in this case is what? The X we're talking about here. So karyotyping is the answer, but however, we're not giving karyotyping, so we'll go for karyotyping. All right, a 40-year-old pregnant woman underwent amniocentesis. The karyotype of the fetus is 47XY21 plus. What's the disease condition? Here it is. Here's the marker already. 21, 21. Remember 21.
And what is
21 is for
plateau? Oh no, no.
21, 21 is for drinking. D 21, you start drinking at
Down
21.
syndrome.
Yeah, so Down syndrome. P is what? Puberty, that's 13 years. Then which other one is here? Okay. Okay. So Down syndrome 13. Sorry, 21. 16. A 20-year-old young woman with, well, let me just skip all of this. Has found what? XXY. That's triple X with Y. What do you think it is?
Klinefelter
Okay.
or
First
Turner.
of all, it's a man, right?
Yes.
It's a disease peculiar to man, so you rule out Turner syndrome.
Never, I think, because it's a man.
Sorry?
So it's Klinefelter, yeah.
It's yeah. I
Yeah,
think
Klinefelter with the XXY there, the extra X chromosome. Although I don't know what this other option B means. I've not seen that one too. You know, there are so many chromosomal disease conditions, but in Krok, they just put in these ones to fill in the other options. We'll talk about Louis Bar, we'll see it shortly. So this other one, this is the one, like I said, I've never heard of, but it's not something we should know on now because Krok has a syllabus which they follow, so they won't go out of that. So Klinefelter it is. Okay. A 7-year-old boy was diagnosed of daltonism. Daltonism is color blindness during a routine examination. His parents are healthy. Okay, this is the mother, this is the father. Parents are healthy, isn't it? But the
yeah.
boy has daltonism. The boy has daltonism. Who can tell me why am I using square and circles here?
To tell if it is recessive or dominant.
No, no. Why am I using square and circle? The shapes.
Ah, why are we using say
Yeah,
oh, to differentiate between female and male?
yeah, exactly. Just gender. Circles are for females. So this is the
Yeah.
mother, and then this is the father. Mother, and then this is the father. Now, why am I shading here? Because the question says this boy is diagnosed with autism, so he has the disease
Mm.
condition. That's why it is that. But the mom, I can shade
But
half of it because she's the carrier, isn't it?
yeah,
Although
it's
they are healthy, the
for
question
X.
says they are healthy.
Yeah.
Sorry.
I just wanted to confirm that this color blindness carries the X chromosome, right?
Okay, yeah, exactly. So, okay, the question says the parents are healthy. So I'm shading half. Healthy doesn't mean the person doesn't have at all. The person can be a carrier but still appear healthy. That's why I'm shading half. But now, continuing the question, his maternal grandfather had the same abnormality. That means this condition was that the mother transmitted to her son was gotten from her own father, isn't it? So here is her
Yeah.
own father. Her father was with the disease condition itself, but the mother didn't have. So that's how she got it. But it didn't manifest in her, but manifested in her own son. So all of this is just X link, X link, X link. So the answer here will be what? Is it recessive or dominant?
I would say okay, recessive
Why?
because okay, do we count carrier as
No. Just who has the disease or who.
Okay,
manifest the
because it
disease.
occurred only in
In
um,
generation one and
generation.
generation three,
Yeah, so it
it
skipped one
skipped. Yeah,
generation.
yeah. So that's why it's recessive. But in every generation, that will make it what dominant. So normally for X-linked recessive hemophilia, that is a disease of the blood itself, a reduced number of blood cells is also a recessive sex-linked mode of inheritance. All right, the frequency of heterozygotes with a genome of phenylketonuria in the population of Ukraine is 3%. What method of genetic investigation is used for revealing early phenylketonuria of a newborn? So straight to the point, phenyl itself is a substance in the body that will see more of that in biochemistry and medical biology too. Phenyl, aniline, and all of those things. But however, the method you use, because it is a chemical substance, you rather go for biochemical method of analysis than any of this. Cytogenic will mean you're trying to analyze the cell, but phenol is not a cell. Phenylketonuria, I mean, it's not like it's a cell problem. Population statistic is just trying to take overall statistics. When you're trying to identify or investigate the phenylketonuria itself, that's the substance itself, biochemical analysis is what you should go for. In 19, question 19, a 9-year-old girl began to walk late. At the age of 1, she had a severe lingering form of pneumonia. There appeared telangiectasis on the skin and then conjunctiva. Immunoglobulin A is absent. The amount of T lymphocytes is reduced. What type of immunodeficiency is it? Can anyone try?
Is it Louis?
Is it what?
Louis?
Louis Bar. I wrote telangiectasis. It's also called Louis Bar syndrome, isn't it? That's what I
Mm.
wrote in brackets up there. So that's why the problem here is what Louis Bar syndrome. Take notes. Here I told you about, okay, first of all, you can see that T stands for telangiectasis and T stands for T lymphocyte, isn't it?
Yeah.
First of all, so you relate that. Bruton is B, and then B also stands for B lymphocytes. So you should use that to remember also. Are we together?
Yes.
So Lewy-Body syndrome is the answer here. And HIV infected patients demonstrated the inhibition of the immune system activity. What type of cell deficiency conditions this immune deficiency? Okay, I didn't write this, I think, but I'll write it here. Now, in the immune system, we have what we call the T helper cells. These T helper cells are what we call the CD4 cells. They just help to, it is in that pathophysiology, pathogenesis of that, what's it called, of that HIV infection I put there. We'll go back quickly and see the picture. Then the T suppressors, they prevent autoimmunity. Then plasmocytes, if you remember that picture of all those immunoglobulins, plasmocytes are the ones that produce immunoglobulin M. Then B lymphocytes, the whole allergy, no, not allergy, antibody, antibodies. Then T killers are CD8 cells, I mean. So the helpers are CD4, the killers are CD8. Now, in this question, okay, so I said I was going to go back to that picture, this HIV infection. That was why I underlined CD4 here, because even if you're not trying to memorize this whole picture, but remember that CD4 cells are the ones that are being activated when it comes to what the infection of HIV. This is a whole pathway. Like I said, I don't take time to so much time trying to explain this pathway, but it's self-explanatory. When you go through it, you'll see it. But CD4 cells are what take charge or responsibility when there's HIV infection. So that's why, and CD4 cells, okay. So going by these options now, going by these options, if I had option F as CD8, what would be your answer?
Sorry, I didn't get it. What did you say?
If you have option F, this option A, B, C, D, E, and F, F is CD8, what would be your answer in this case?
Isn't it A?
Is it what?
Isn't it option A?
Yeah, it will still be option A because it's just CD4. I just brought in there to see if you can recall this, and then obviously once you remember that CD4 is for HIV, and then they're also called T helper cells. But if option F tells you CD4, obviously it's CD4, but they won't give you both options together. They can either give you CD4 or give you T helper cells. That's why I wrote the other names in brackets. All right, so CD4 cells. Investigation of the immune system. Condition of a patient with chronic mycotic affection of the skin reveals cellular immunodeficiency. What parameters increase? Okay, decrease is the most typical in such cases. So
Is it
there's immune. Is it what?
T lymphocytes since this is cellular?
What option is that? I can't hear you clearly.
She's
C.
talking about option C.
C. Okay, why is it C?
Because it is cellular immunodeficiency.
Okay, cellular immunodeficiency. This cellular immunodeficiency is still talking about the kind of reactions too. It suggests the kind of reactions too. Here I talked about acid, right?
Yeah.
I talked about acid here. So we have both, okay, here is type 1 is A, anaphylactic, type 2 is cytotoxic, type 3 is immunodeficiency, type 4 is immunodeficiency, immune complex. I think it's immune complex, sorry, not immunodeficiency. Let me correct it here. Immune complex. Yeah, acid, and then D is the late type. So here I'm telling you that what in the question they talked about a chronic mycotic affection of the skin reveals cellular immunodeficiency. Cellular immunodeficiency. Now, the cellular immunodeficiency is talking about generally the cell itself. That's where this immune system, the immune systems are being localized there at the cells. And when we look at all of this, we have cells are destroyed. That's for type 2, which is cytotoxic. Of course, the names come from when you hear cytotoxic, it means when you hear cyto, it means cell. Cytotoxic means a toxin to the cell. So this definition, cells are destroyed by bound antibody, either by activation or complement by cytotoxic T cell. Cytotoxic T cell and blah blah blah, all of these other things. Meanwhile, when you look at this other, that's the D. The cells are secreted by cytokines which activate macrophages and cyto T cells that can cause macrophage accumulation. Now, these T cells here are not the main cells, but they only try to what? Assist the macrophages. The macrophages, remember, macrophages are what? Clean up the debris too, or eat up the cell, sorry. So these are like, and this is what happens in delayed reaction, hypersensitivity reaction. So the T cells here are not the ones reacting. They're just helping the macrophages to develop, and then macrophages are the ones that now act on the pathogen or the condition itself. So the cytotoxic is what we should refer to, and then the type of cell that's linked there is what the T cells, T lymphocyte or T cells there. So the question was pointing towards, that was question 21. Yes, the immune system condition of a patient with chronic mycotic affection of the skin reveals cellular immunodeficiency. What parameters decrease in the is the most typical? Of course, they even said most typical. In this case, there could be other cells too that are associated. So that's why it is a T cell or T lymphocyte.
I see.
In 22, hormone therapy is obligatory for depressing autoimmune reactions after transplantation of organs, what hormones are used? What do you think? Based on what I explained, mineral
B.
corticoids, glucocorticoids. B as in mineral,
Wait.
or let me help you a little. Here, look at what I underlined under glucocorticoids. Anti-inflammatory. Can you see it?
1 second. Yeah, it is great.
Anti-inflammatory for glucocorticoid. No idea. Mineral corticoid is just all about ions being moved in and out, being secreted, being secreted or being reabsorbed. Sodium water is reabsorbed. Potassium protons are being secreted. All right. That's 22. So here we're talking about depression of autoimmune reactions. Autoimmune reactions. And I told you that immune reactions are what? Inflammation, isn't it? Well, when you're saying autoimmune, that means that is anti-inflammatory reaction. That's what this means too.
Okay.
Anti-inflammatory. Yeah, option E. Here, there's a 2-year-old child that has been diagnosed of hypoplasia of the thymus gland. What parameter of the immune system condition is typical of this? Did you remember when I said something about thymus? Thymus. I told you a triad. I gave you a triad. I said there's what? Ataxia. There is what? Reduced immunoglobulin B, and then T cells. And then there is the last one was spider angioma. Immunoglobulin A, I mean, and then the spider angioma. Who can remember that disease condition? Okay, that's for Lewy. That's for Lewy disease. Digest syndrome is different. I told you about catch 22, right? Sorry, that's for digest syndrome. Catch 22. Let me erase this. Cat C is for what? Cardiac anomalies, cardiac problems. A is for okay, we'll go back to the picture. T is for the thymus. Then what again?
CH
I know.
again.
Yeah, CH. I know one is for cardiac. I'm trying to remember what the other C is again. Okay, let me go back there. Okay, cleft palate. Yeah, the A is abnormal phase, cleft palate, and then there's hypocalcemia. So this thymus or thymic hypoplasia, can you see it here? Can you see it?
Yes.
Yeah, that's what the question is suggesting us about. So that's why, okay, the disease condition. Have you seen the name of disease there? Right? Digest syndrome. So let's go back to the question itself. 23. Now they're not asking about the disease condition, but they're asking about what um the type of okay, I didn't mention this to you, sorry. T lymphocytes are actually produced by the thymus too. Should it be here? Excuse me. I think it should be under that adaptive immune system. Okay, it's not there. It's not there. But T lymphocytes are being produced by thymus also because thymus is part of the immune structure. Meanwhile, all those antibodies are produced by B cells. Take note of that from now. Let me write it here for you. Thymus produce T cells. Again, for you to remember, T stands for thymus, T stands for T cells. And then uh, the B cells. Sorry, macrophages. Produce these cells, macrophages, and I'm trying to remember the other components. All right. So the T cells here, the thymus amine suggestive of a particular type of cell that is being affected. Here they say what parameter of the immune system condition is typical of this immunodeficiency. So the deficiency will be on the what? On the T lymphocytes. Okay. Digoxin. Let me also write digoxin so you remember from here. These are features of Diger syndrome. A 27-year-old woman suffers from itch and burning sensation in the eyes, lacrimation, exudation of the nose. The symptoms appeared in summer. After her trip to the countryside, a doctor diagnosed pollinosis. What type of allergy did the patient? So, okay, maybe I didn't actually define those allergic reactions. There's the type 1, 2, 3, and 4, which are anaphylactic. Anaphylactic reactions are those reactions that occur immediately. Those are reactions that occur immediately. Cytotoxic are what? Injury to the cell. Immune complex, which we saw in type 3 reaction, are what? Forming a deficiency in the immune system. And then the delayed hypersensitivity, these are just delayed reaction, just like how you have transplants. Maybe after liver transplants, and then the person delays to react, the person begins to react maybe a week or 2 weeks after, or even some months after. That's delayed hypersensitivity reaction. So in this case, now this one suffers from itchy, anomaly, itchiness, burning sensation, lacrimation. All of these don't wait for any other reaction or cause of disease to take place. Even what we call another one will be skin rash. All of these are immediate kind of reactions. So that's why they are termed anaphylactic reaction. Because all of these reactions appear. Imagine a sting, a bee sting, I mean. When a bee stings, it doesn't wait till days before you begin to react. In short, there and then before you know it, within seconds, for people who have excess reactions to those things, they begin to react with is it skin bumps or rash or goosebumps. All of those things put together. Also, before injecting the patient with anti-tetanic serum, a sensitivity test for the serum was performed. It showed positive reaction. What substance should be used for specific desensibilization? Okay, that's when I put that picture of that serum. That's also called serum sickness. So in this serum sickness now, when there is an let's take for example, anti-tetanus being injected, so the immune system begins to attack. This is like, of course, you can see here written type 3 type of reaction. By the time they begin to react, then they cause a what? A reaction, obviously. So for it to reduce that reaction, you need to give in small doses. For those of us that took COVID vaccine, I can't remember the actual meals that was given, but we went for the first dose, the second dose, and the third dose. Now, maybe if you went for the first 2 doses, those 2 doses should be the actual doses of what you need in your system. But the third dose will be like the complementary dose to help boost your immunity also. So the first 2 doses actually they can be given at once, but why do you think they're broken down, given in 2 different occasions? So that in case there's any reaction, at least it was just a little dose I was given to you. Then you come after, I can't remember the exact, was it 3 weeks? We went for the second dose or 1 month? You go for the second dose. So in total, that's the number of doses that you need, but not given to you at once. We're given in drops or in little. So that's the same thing here. This question is pointing out now. If not, to give you what we call that serum sickness, and you present all those fever, headache, nausea, vomiting, and any other kind of reactions too. So in this case now, this patient was injected with anti-tetanic serum. That's anti-tetanus. a sensitivity test for the serum was performed, it showed positive reaction. So it means that this person had this serum sickness. There was a positive reaction. It means that the dose given to the person was too much to handle at that moment, because you're giving vaccine trying to stimulate the immune system to produce more cells. So what substance should be used for specific desensibilization? So it should be the low doses of that antitetanus that should be given, and not the actual dose or the higher dose that should be given. They're trying to desensibilize the reaction itself. So the dose itself is given in very little quantity than when you try to give the actual dose, the complete dose, I mean, all at once. So that's what this question is trying to ask here. So in this case, we'll look at the small doses of anti-tetanic serum being given to desensitilize. Desensitilize means you're trying to, okay, there's a reaction, isn't it? Normally, because that's the first time you're receiving that vaccine. So obviously there should be a reaction. But how do you reduce that sensibility of that reaction? By the time you give that small dose, you've either, okay, here it is used, the word used is desensibilize, but you can use the word desensitize also, in the sense that you're trying to make the immune system and the body system get used to that dose. Try to get try to understand the dose, the serum, the vaccine you are trying to give. So by the time you come for the next dose and then you are giving more doses, the body must have gotten used to and even produce antibodies for those vaccine for those yeah for the vaccine itself. So small doses will be better to use in what desensibilizing the patient's immune system first of all. All right, this is another type of reaction. We have what's okay. I didn't tell you about Coombs test. That's separate. Leukopenia followed the treatment with pyramidon. Pyramidon is like it's an analgesic pain reliever. So anti-leukocytic antibodies were found in the blood. What type of allergic response by Coombs and Gell's test took place in this case? So just to show you what the Coombs, that Coombs is supposed to be spelled C, not K. This is a Coombs test. So what happens in Coombs test is that the blood sample is being drawn out, put in a test tube, and then they introduce the Coombs reagents. They introduce the Coombs reagents. By the time you introduce the Coombs reagents, then they produce antibodies. First of all, the blood has antibodies, but these reagents now will combine to these antibodies, and then you see that positive reaction. So let's see what we'll have here in the direct Coombs. Here, blood sample from the patients with immune-mediated hemolytic anemia. The antibodies are shown attached to antigens on the red blood surface. So these antibodies come directly and bind on the blood antibody surface itself, on the blood surface itself, antigens, I mean. Meanwhile, for the indirect, these antibodies are produced by the body that bind on the antigens here, and then the antibodies in the Coombs test now bind again to these antibodies. They have this affinity of binding. So that's what the test is all about. And what are we testing for? We're just trying to test the what we call antibodies first of all being present, and then trying to test the reaction itself. So we'll look at these types of reactions again, the hypersensitivity reactions. We'll look at the 1, 2, 3, 4. Again, when it comes to allergies and those hives, eczema, those are immediate or anaphylactic reactions. So that's aside. When it comes to red blood cells being destroyed by complement or antibody during transfusion. So the Coombs test is all about the antibodies that can attach to the red blood cells, because the red blood cells will carry the antigens. So that's what the Coombs test is all about. So type 2 or cytotoxic reaction should be for the Coombs test. Should be for the Coombs test. So the kind of reaction there is what they're asking us. Okay, yeah, it's cytotoxic. That's type 2. All right. A 27-year-old patient used eye drops containing penicillin. In a few minutes, take note of this, in a few minutes, he had what? Skin itching. edema of the lips and eyelids, cough with singing appeared. Arterial pressure began to decrease. All of this happened was in few minutes. What do you think? What kind of reaction do you think? Is it delayed or immediate?
Sorry, what did you ask?
Immediate.
What type of
Sorry.
okay, yeah. I was asking what type of reaction is it? Is it immediate or delayed?
Because
So it
after
is
few
immediate. Yeah, it is immediate, but that's not what they're asking. They're asking of the immunoglobulins. I just try to ask that question to see if you can remember types of reactions. So this is anaphylactic. But then we're being asked about the immunoglobulins. The table is up there. I don't want to scroll. But remember what I told you about IgE, which is responsible for allergic reactions, isn't it? Because this all of this points towards allergic reactions. That's why IgE, the option with the IgE, although they have IgG and IgE here, but the main immunoglobulin is IgE here. However, if you have been told about all those delayed, sorry, if you have been told about some transplant, organ transplants, and then some reactions occurring after some weeks or months, they know the kind of reaction is what type 4, that's delayed hypersensitivity reaction. You have a table there for the parameters defining all of these other immunoglobulins. All right, a 10-year-old girl with congenital heart. Okay. This 10-year-old girl has what? Congenital heart disease, thyroid gland defects, suffering from what? Viral and fungal disease. Immunological investigation revealed the absence of T cells. What do you think? What is this suggesting to you from this underlined terms here in the question? Congenital heart disease, thyroid gland defects, T lymphocyte defects or absence. Catch
Uh,
the cardiac anomaly, that's the heart. We have the thymus hypoplasia, that's reduced cells of the thymus, which will mean that there's what? Reduced T cells produced, isn't it? Then the other C is what? Cleft palate. We don't have that feature here. We don't have the hypocalcemia. But all of that's thyroid problem here. We tell that there's problem with the thymus too, and then hypoplasia. So all of this will be suggestive of what the um, digest syndrome. But let's see if that's what they're asking. They say what disease of the immune system takes place in such cases? So here they didn't ask about digest syndrome directly. They asked about hypoplasia. Here they just mentioned what one feature of the digest syndrome. Do you understand how this question was twisted? Or do I explain it again? We have for digest
I
syndrome.
understand.
Okay. We have those catch-22 features you will have there, but they didn't go straight to ask what disease. Okay, they asked what kind of disease of the immune system took place, but they didn't put digest syndrome here. They just put hypoplasia of thymus gland. Whenever there's thymus gland hypoplasia in digest syndrome, so you should go for this option. Then the other options there.
I have a question. Did you say
Yeah.
catch 22?
Yes.
I forgot what the 22 part means. Sorry.
Okay, we'll have chromosomes on every. We
Okay.
have
Yes.
pairs
Okay.
of chromosomes.
Yes.
Yeah. So
Yes.
deletion of the longer arm of one of the chromosomes on the 22 actually chromosome number 22. That's what happens there.
Yeah, I forgot. Thank you.
All right. So a 5-year-old boy, like his grandfather, suffers from pneumonias and purulent disease of the skin. In short, do I need to continue? There's B lymphocytes here. What's the answer? B.
Brutons.
Yeah, Bruton's disease. An injection of a large dose of antibodies for the basal membrane of glomeruli of the experimental animal's kidney led to development of acute glomerulonephritis. What type of? So this is still talking about what? Coombs test, isn't it? What do we say about Coombs test? Because here they mentioned it clearly. Coombs test is all about antibody antigen reaction with the red blood cell, and that's what this is explaining. So it is cytotoxic reaction. A patient with proteinuria hematuria, that's protein in the urine, blood in the urine, edema, and arterial hypertension. Sorry, this is a bit blurry. Arterial hypertension was diagnosed with acute glomerulonephritis. What type of, okay, here again, we still have what Coombs test in the question.
Can you please
Okay,
zoom? Can you please zoom more a
okay.
bit? Yeah, thank you.
Yes, diagnosed with acute glomerulonephritis. What type of allergic response, according to Coombs and Gell classification, the cause of glomerulonephritis? So it is still what the cytotoxic,
That's toxic.
according to,
Yeah.
yeah. So 32, a man complains of rhinitis, a slackening voice, reddening of the eye. We still have the same. I'm coming.
Inflammation.
A woman with complaints of rhinitis, slackening of voice, reddening of the eye, leads on lacrimation in spring. What type of allergy response, according to classification of Coombs and Gell, provokes this disease? Okay, let me see the other question on Coombs test first. The first one we answered. I'm coming. I need to make a reference. Mm, okay, okay, okay. All right. Please take notes, well. The Coombs test, of course, Coombs is the name of a scientist. That's what we call Coombs tests. Or, okay, that's what we call Coombs reaction. Reaction that is on the basis of what the test being run. However, there's another thing called what Coombs classification, which I've not touched here, of diseases. But this Coombs classification is that same classification we have up there concerning what? Type 1 hypersensitivity, type 1, 2, 3, and 4. Take note, if they are talking about the test itself, then this type of test is under the, for the Coombs test, I mean, it's just about antibodies and antigens reaction on the blood cell, red blood cell. But for Coombs classification, because he was the one that determined or classified this hypersensitivity reaction to type 1, 2, 3, and 4. So in that case, now we still need to go back and look at the question itself and then make proper reference. So first of all, we erase this cytotoxic we have here. Yeah. So now in this question, we're talking about glomerulonephritis. Let me see what other features were included. They said proteinuria and hematuria, of course. These are all features of glomerulonephritis. So according to Coombs now, the classification, not the test, please take note of the difference. Okay. Profuse. Yeah, according to the classification, we have glomerulonephritis here under type 3, isn't it?
Yeah.
Yeah, we have glomerulonephritis here. So that will be type 3 or immunocomplex reaction. Remember, they're asking us about the reaction. I'll show you the questions, the two questions, and then you try to differentiate. So here it is, there over, I mean, it is the type of reaction. So here, okay, first, since we're on this page, so I don't need to go back. For type 1, we have things like what anaphylaxis reaction, which are what like allergies, which includes what fever, food allergies like hives or itchiness due to peanuts, ingesting peanuts or all those yogurts for lactose intolerant people, and the eczema. Then for the blood, for the antibody reaction on the blood cell itself, it is the Coombs test, not Coombs classification. All of this is classification. The whole of this hypersensitivity is a Coombs classification. But then this particular test, where you test with the red blood cells antibodies, is Coombs test. Take note of that. Then for type 3, we have the glomerulonephritis, we have rheumatoid arthritis, we have SLE, systemic lupus erythematosus. Then for type 4 delayed, it is in the case of what? Autoimmune diseases such as diabetes mellitus type 1, there are multiple sclerosis, rheumatoid arthritis too. Although we have them in these two, but then to be differentiated for you properly. Then you also have what in terms of organ transplant. So why we went for cytotoxic in that first one? Because that question was referring to the actual blood test that was carried out. Yes, yes. So yeah. Follow treatment with when there was anti-leukocytic antibodies were found in the blood. So antibodies found in the blood were now bound into. So this is suggesting that the Coombs test was carried out. That's why to be under cytotoxic. But let's look at the other questions here that we're about to answer. They said there was what? A proteinuria, edema, and then short the disease condition is what? Glomerulonephritis. And they didn't say test. They asked about, according to Coombs classification, what is the cause of this glomerulonephritis? So in that case, it will be it will be the type 3 or immunocomplex. This is just the classification general they're asking about. So also in this question, we have features of what? Rhinitis, slackening of voice, reddening of the eye. All of these are allergic reactions that occur immediately. What type of allergic response according to classification? This is still talking about classification, not the test itself. So this is what anaphylaxis or type 1. Okay. With time, yeah, this is a bit confusing, but with time, by time you answer over and over and over, you get used to it with time. So that's why just in any way you can try to answer those questions. I send those weekly questions because on my own part, I still try to twist them and then I see how you can reason. That will help you a lot. If okay, this part I was supposed to talk briefly on something before we answer. So there's what we call violation of the blood volume. The violation of blood volume, it means that whatever it is that stops blood volume from being transported, and this is obviously what's in the vessels. This is a bit blurry, sorry. I'll try to explain as much as I can. So when we talk about ischemia, it means that what there's reduction of blood due to it can be obstruction, it can be spasm, compression, whatever. So when it is spastic, that means the blood vessel itself is narrowed. That is spastic cause of this reduced blood volume. Obturation means there's what? An obstruction there. It could be thrombosis, it could be deposit of sugars, that's in the case of diabetes or whatever it is. Compression means the vessel itself is compressed. And then due to repetition is just the cause itself. Okay, squeezing. It doesn't take normal course. The vessel itself has been folded, and then you have this repetition. So that's what this is all about. So these are just different types of different methods which ischemia can come about. Then we have what we call trying to differentiate what we call neuroparalytic. There's what we call arterial hyperemia, first of all. Arterial hyperemia is just increase in temperature in the arteries. It could be due to any other reason, but we have either neuroparalytic, and then neurotonic. So neuroparalytic is when there's a damage to damage to the nerve or vessel. And the neurotonic can be due to any other cause outside damage to the nerve or vessel. So that's what the difference is here. Then clotting factors or the cascade of clotting, of blood clotting, I mean. Clotting, why does clotting occur? When you have a cut, normally you have the clotting factors in your body system, but when you have a cut, it's until there's that cut before they begin to aggregate and then try to react or try to close up that ruptured vessel. So what happens is that the first thing that happens is what? There are broken vessels, and then your system, your clotting system, clotting factor system, or what you call fibrinogen system itself, tries to activate platelets. So this will be the second thing that will be done. Platelets now try to aggregate on that broken vessel to stop the bleeding first. So while the platelets aggregate there, they wait for the fibrin to then come. When the fibrin come, that's fibrin will then come, and then once the fibrin are there, the red blood cells, that's platelets, I mean, will then give way for the fibrin to act and then repair the vessel, the broken vessel. So that's how clotting system, that's how the clotting factor is being activated when there's rupture. Then more to those emboli we talk about, the fat embolism. Okay, the gas embolism, that's the one we talked about, right? Actually, it could be air embolism also due to some occupational diseases. Then gas embolism is just as a result of being exposed to gas. Then we also have different types of embolism, but the one I'll just mention here is the one that is common, which is fat embolism. Fat embolism is due to fracture or even as a result of sickle cell anemia too. So that's how fat embolism itself develops. In terms of sickle cell anemia, I don't really know how it does that, but for the fracture, when the bone itself is fractured and it pierces, of course, there are so many subcutaneous and fat tissues. So you can have all of those. When it ruptures, it can pierce blood vessels, and then you can have the deposits of those fats also coming in. And then that's when you refer to as fat embolism. So quickly we'll look at this last set of questions, and yeah, that'll be it. So a 57-year-old man complains of heart pain, which occurs after negative emotions. A doctor diagnosed ischemic illness of the heart, that's stenocardia. Ischemic disease of the heart. What mechanism? Based on those mechanisms, what happens in stenocardia? There's tightening of the vessel itself. So you think of what? Constriction of the vessel. The types of ischemia mentioned. Okay, spasm. Spasm is what they use here, the word they use here, but it still means what? Constriction. It still means the constriction. So spasm, because of stenocardia, there's constriction of vessel. That's why it is angioplasm. Spastic, I mean angiospastic, that's spasm of the vessel. Angio is vessel. A plaster dressing was applied to a closed fracture of the humeral bone. Of course, this should be the end of our question. What type of embolism do you think? There's fracture of the bone.
It is fat embolism.
Okay, it's supposed to be fat embolism. The next day, the hand swelled and became cyanotic and cold. What kind of pathology? Okay, here they're not asking us about kind of embolism. They're asking of type of pathology. I had that picture before, which I didn't remember to add again. Venous hyperemia and arterial hyperemia. Straight to the point, I'll just tell you the difference between these two. When you talk about venous hyperemia, it gives features of cold, bluish coloration. Bluish coloration. That's like in cyanosis. And then for the arterial hyperemia, it gives the features of the opposite, which is warm and reddening of the skin or the region, red coloration. So that's just the difference between the hyperemia. So the hyperemia itself is the reaction that occurs due to change in temperature based on how the temperature these vessels are carrying. So of course, the first part of this question was suggestive first of the kind of embolism, but no, that was not what the question was asking. There was now what the swelling, and then that place became cyanotic and cold. So this is all about the kind of circulation of temperature that occurred there, which is what venous because of the cold and cyanosis. After physical activity, all of a sudden, a patient with thrombophlebitis of the lower extremity developed dyspnea, sharp pain in the chest, cyanosis, swelling of cervical veins. What kind of pathology took place? They told you that there's what thrombophlebitis. There's a thrombus there from the vein itself. So what would be the answer here? All of these options carry thromboembolism, but thromboembolism of what do you think?
Of the. One second. Is it C?
C,
It's not Venus, no.
venous. Would have
No.
venous. So what option are you calling?
Oh,
Okay.
sorry.
There's dyspnea, there's sharp pain in the chest, there's cyanosis. All of these are features of respiratory system. Are they not? It means the emboli occurred there around the chest region or very close to the respiratory system. That's what is affecting those structures first. So the thromboembolism will be of the pulmonary artery. Anyone that has the pulmonary, is it about brain? No. Is it about coronary? That's hard to know. Is it about, I think that's supposed to be mesenteric here. That's about the abdomen? No. Is it our portal vein? Portal vein is liver? No. So this is suggestive of the respiratory system. That's how we go for pulmonary. The patient with
I have a question. Sorry, you know
yes.
when I was saying venous, it was a mistake. What I wanted to say was this thing vessels, but then
Okay.
because of the thrombophlebitis,
Yes.
like I don't understand how is it because of the rest of the symptoms that we are choosing pulmonary?
Okay. Thromboembolism of vessels is correct generally, and that's why you have vein here, you have artery, you have vessels, you have vessels. So in every case, thromboembolism of vessels will apply to every. But look at these symptoms. The patient presented with what? Dyspnea, that's difficulty in breathing, right? Sharp pain in the chest, that's a problem with the respiration. Cyanosis is a conjunction of the respiratory and cardiovascular system. But however, you have more of the features under respiratory system. That's why you think of thromboembolism occurring around the lungs.
Okay.
Because here we have brain, which is not talking about brain. We have coronary artery, that's talking about heart, is not. Mesenteric talking about the abdomen together with with the abdominal organs, no. Then portal vein talking about the liver, no. This talk about about respiratory system. So it's pulmonary that is closest to what this question is asking.
Okay.
Sorry, what did you say about option E?
Portal is liver, portal vein.
Ah, okay, okay. I didn't hear that part. Okay.
A patient with obliterating arteritis underwent ganglionary sympathectomy. So this is what removal of the sympathetic ganglion or sympathetic nerve, which has the ganglion in it. So there's sympathectomy, that's ganglionary sympathectomy, removal of the nerve which conducts for sympathetic ganglion. So what is this suggesting? Because this is removal. So this is what's neuroparalytic. Remember what I told you when there's removal or what other example did I use there? Removal or okay, damage of the nerve vessel, of the nerve or vessel. So that is for neuroparalytic. The positive therapeutic effect of this operation is related to the development of arterial hyperemia of lower limb. What is the pathogenic type of this hyperemia? It will be what? The neuroparalytic. Okay, three more for us to go here and we'll call it today. During an experiment, a small crystal of H, that's mercury chloride, was placed near the mesenteric vein of a frog that's around the vein around the abdomen, close to the internal organs of the abdomen. This operation led to the formation of a blood clot on its wall. What is the initial point in thrombogenesis? So all what this question is asking is what um, there's thrombogenesis, right? Thrombogenesis is what? Um,
Production thrombus. Thrombus.
yes, not really okay, yeah, production of the thrombus. That's what production of platelets, platelet production. And what's the function of platelets? To help with the clotting, isn't it? When there's rupture, isn't it?
Mm.
Now they're asking you what was the initial point? What even led to the production of these platelets in the first place? Remember when I told you the whole fibrinogen cascade of a thing? What happens? The first thing that happens is what? Rupture of the blood vessel. It is that rupture that is the first thing that will happen. Then before there will be bleeding, and then platelets or thrombocytes will come and aggregate first on the site to stop the blockage, and then to give time for the fibrin because there's a whole cascade of fibrinogen to be activated. So to take time. So by the time the platelets go there to block, the picture is still there. You can still make reference when I send the note. Then eventually they will release the platelets. So the initial cause or the point of thrombogenesis for thrombogenesis to work, or what was the initial point? It was a damage or rupture of the vessel that led to that.
But what about option C?
That's activation of adhesion of no, that's like second. Let me just show you the picture. That's like second or third. See, option C was what? Activation of adhesion of thrombocytes, right? That's platelets. So this is
Mhm.
first. That's why I had to circulate here. This is second. So this is not initial. This is the initial here, broken vessel. Yeah. And then before the third, which will be activation of the cascade. That's the fibrinogen cascade. So the initial cause of it was even the injury which occurred on the vessel, that's rupture of the vessel, damage of the vascular wall. Yeah. The patient with fracture, here we can see fracture. What kind of embolism is it?
Fat.
Okay. A 42-year-old man with neuralgia and trigeminal nerve complaints of recurrent reddening and sensation of heat in the right part of the face. So there's neuralgia. Neuralgia is just pain on the nerve, and that pain on the nerve will be manifested on that area that nerve is supplying. So in this case, there's pain. Trigeminal nerve is the nerve supplying the face.
Optic and the maxilla and the jaw.
Yeah. So now it is not a damage to the nerve. It is what? Just nerve pain. That's why I told you damage to the nerve or destruction of the nerve will be what? Neuroparalytic. But any other cause outside that will be what? Neurotonic.
But here it's not affecting the nerve.
It is. Neuralgia is pain on the nerve.
Okay. I'm
Yeah.
not seeing well the question. That's why I'm
Okay,
asking.
yeah, it is. It's just the pain on the nerve. There's no removal, there's no cutting of the nerve. That's why the answer will go for word neuralgia. All right. So any question at all?
For now, no. Thank you.
All right, I'm still
Okay.
trying to compile. I'm still trying to compile for that physiology, the whole physiology, because what I want to do, you know, the what do you call that? The basis we answered for physiology and the ministry book. I want to compile them all in one PDF so you have access to everything all at once.